Hi, I'm T with SRNTA, and today I want to talk about nursing foot care interventions for the state of Louisiana. And are you running into any barriers as a nursing entrepreneur in your state? So, as a nursing entrepreneur, I have a nursing concierge business, and recently, with a lot of information and research that I've done on foot care nursing, I was very interested into branching out into foot care, and actually am offering foot care services and offering medical pedicures. However, I have found that it is very limiting the type of services that you provide with being and remaining within your scope of practice in the state of Louisiana. And I wanted to know, are there any other states out there that have barriers that are so constricting? In the state of Louisiana, nursing foot care is broken up into 3 different levels, and that is basic, intermediate, and advanced, with of course the advanced level being for the advanced practice practitioners, nurses, and the basic level being pretty much the only thing that you can do as an RN, independent of a physician. And there is a breakdown on the nursing website for the Louisiana Board of Nursing website on the scope of practice, of course, of what you can do in the state of Louisiana. And like I said, the basic things that you can do independent are very limited. To me, I think in essence, it's just pretty much is no more being a nail tech. The intermediate level must, in it to perform any task out of there, you would need a prescribing doctor or someone with prescribing capabilities. So again, you would either need a physician or you would need to be an advanced practitioner to perform the skills in the intermediate section. So it really begs to differ. Is it worth being a foot care nurse in your area if you are not an advanced nurse practitioner? It seems that on the Foot Care Association website, yes, that is a podiatrist that is running that, but on a lot of stuff, a lot of information that I've seen about actual foot care nursing, I'm not for sure what states these people have resided in, but it didn't really seem like a lot of them have been FMPs. Like I said, but it does seem that if you are operating in the state of Louisiana, the only way, not the only way, but it just seems like in order to be able to do a lot of the skills that it seems like a nurse should be even capable of doing with experience, you can't even perform those skills without it being considered out of your scope of practice. And that was the thing that I wanted to talk about and try to see, are there any other people that are running into those type of barriers? And if so, what do you do? I mean, I know, of course, you can't do anything about not working out outside your scope of practice. Are you looking at pursuing your education and possibly going back to school? I mean, I have looked at that as an option. The only downside to that is just I wouldn't be interested in FMP for any job that is working and being an employee of the hospital. I would only be interested in FMP as being a nursing entrepreneur, and I would need the type of clientele that is at least trending in that direction to support that type of student loan debt, to want to embark on that type of adventure, so to speak, a journey, to even look at trying to get my FMP just to be able to practice foot care interventions that, because like I said, the intermediate part, it even goes as far as like wound care. I can understand why you can't do a culture without being an independent practitioner, but a nail trim, debridement, I can understand that. Buffing for non-painful corns and calluses that may require use of a curette. You can't use a nail nipper. So even to the point that you can't refer patients for treatment. Those things I think are very limited and unreasonable as far as like saying out of your scope of practice is being an entrepreneur. But I just feel like that's one of those things that are more politicky, to try to keep us as employees of the hospital, so to speak. Because the last I looked, some people said me it's like what, 90,000 in student loan debts to be an F&P. So I need to see something that would really like make that worth my while. I don't need my annual income to still only be 90,000. I could do that just being a regular staff RN. Too many F&Ps with second jobs as a staff nurse because they aren't making enough as F&Ps. While I've been doing nursing entrepreneurship, and just even before I ever started doing that, I've always had a PRN job, and it's a bad habit. And when I go recently here, these last few years, when I go get a PRN job, there's always an F&P oriented with me for a staff RN job. And I just feel like if you don't put in that much time, that much effort, that much student loan, there's no reason why they should need another job. And I don't want to be one of those people. So let me know what you think. What's going on in your state? Do you have very restrictive scope of practice when it comes down to foot care nursing or any other type of nursing, as far as that goes, as far as like trying to do anything independent in nursing entrepreneurship wise that would leave you not having to rely so much on needing a physician or an NP degree? Let me know what you think.